Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Stroke Rehabilitation. Introduction. Strokes are very serious and can result in death or disability. Rehabilitation, physical therapy, speech therapy, and occupational therapy are necessary to improve the functions of the body after a stroke. Rehabilitation retrains the brain to think, understand, speak, move, and feel. This program will help you better understand the rehabilitation options available for patients who have had strokes. Rehabilitation. Rehabilitation helps improve the chances of a successful recovery from a stroke. The first few days after a stroke are very critical. During this time, the brain could swell, causing even more damage to the brain. In rare cases, this could lead to death. About a week after a stroke, the patient's condition stops changing and the deficits seen at first may tend to improve on their own. Problems that remain after deficits have improved, such as weakness and speech problems, can be very disabling. Rehabilitation can help to restore some losses that the stroke caused. There are two main goals of rehabilitation. One, to strengthen and re-educate the patient to help him or her improve. 2. To teach the patient how to manage as normal a life as possible within the limits of his or her deficits. Rehabilitation is a combination of three kinds of therapy. 1. Physical therapy. Strengthens muscles and improves the patient's walking skills. 2. Speech therapy. Re-educates the patient on everything that has to do with speech. This includes how to speak, understand, read, write, solve problems, etc. 3. Occupational therapy. Teaches patients different tricks that will help them lead as normal a life as possible. Rehabilitation is started as soon as the patient is medically stable. This is usually a few days after the stroke. For rehabilitation to be successful, it is important for the patient and his or her family to cooperate and show enthusiasm. Even though the therapies are only scheduled a few times a week, the patient and his or her family should do therapeutic exercises on a daily basis. Even though rehabilitation has gotten much better in the last 20 to 30 years, stroke victims are still sometimes not able to get back to the way they were before the stroke. It is important to keep working on skills and not get discouraged. Physical therapy. The goal of physical therapy is to strengthen muscles and improve gait, which is walking skills. Physical therapy also helps loosen muscles and joints that may have become stiff in the arm or leg that was involved with the stroke. Exercises are given to the patient and his or her family to strengthen weak muscle groups. They should be done many times each day. The therapist helps the patient to walk at first. Initially, the patient uses parallel bars for assistance. As walking skills develop, the patient can use a walker or cane to get around more efficiently. The hope is that in time, the stroke victim will be able to walk without help. It is important to do walking exercises only while the therapist or a family member is around. Without extra people around to help, the patient could fall and break a hip or a vertebra. The physical therapist may suggest the use of braces for the arms or legs to improve a patient's ability to move around and work. Such braces may be used to prevent a foot from dragging or a knee from buckling. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Speech therapy. A speech therapist teaches and re-educates patients about all functions that involve speech. These functions include, but are not limited to, speaking, understanding, reading, writing, improving memory, solving problems, dealing with numbers. Speech therapy is done with the help of exercises that help reinforce these activities in the healing brain. Just like with physical therapy, it is very important to do the exercises over and over. Until patients have fully improved, they should be supervised when balancing a checkbook or when making major decisions. Occupational therapy. Occupational therapists help patients perform daily activities with the help of tricks and specially designed gadgets and devices. Occupational therapists teach patients how to dress themselves, take baths or showers, eat, shave, cook, etc. For example, occupational therapists can teach patients how to use a reacher. A reacher works like an extension of the patient's arm. It is very helpful for picking up objects without bending. Reachers also help patients put pants on. Occupational therapists can recommend special silverware with oversized handles to help patients eat if their hands are weak. Occupational therapists can suggest ways to change a stroke patient's home to make it more accessible and safe. Occupational therapists help stroke patients get fitted for braces that will improve their function. Braces also decrease the chances of severe joint stiffness. Braces can be used on the elbows, wrists, knees, or ankles. Aftercare for stroke survivors. Stroke survivors may face other challenges after a stroke. These include mental, emotional, and behavioral changes that may improve over time. Some people experience personality and mood changes following stroke. These may include depression, anxiety, irritability or anger, pseudobulbar effect, PBA, lowered self-esteem. Seeing a mental health care provider can help. Finding a stroke support group, meeting with a counselor, or taking medications may also help. Some people also have difficulties with sexuality after a stroke due to physical limitations, medication side effects, fatigue, changes in appearance, emotional challenges. Talking with your partner, healthcare provider, or counselor about your concerns can help. Family members may struggle to care for the loved one who had a stroke. They may suffer caregiver burnout. Finding a support group for caregivers or asking your healthcare provider for resources can help. To prevent another stroke, survivors should avoid smoking, control blood pressure and diabetes, take any prescribed medication. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Even though strokes can be very disabling, new rehabilitation techniques give stroke survivors more of a chance to stay independent. The success of stroke rehabilitation depends mostly on the patient and his or her immediate family. Exercises should be continued even after initial deficits have improved. This gives patients the best chance to get back to a normal life. Thank you for using Explain.